Every year, millions of Americans are affected by cancer. One major issue with this is the actual time it takes to diagnose a patient. On average, it takes around 6 days for a patient to receive a diagnosis and begin treatment. With cancer, early detection is critical, and those 6 days are a luxury few can afford. The software that physicians are using to detect cancer is not user-friendly, nor is it integrated between systems, creating headaches for physicians and additional time in the diagnostic process. In addition, according to a 2016 Johns Hopkins study, over 250,000 deaths are associated with some type of medical error. This is a number that is far too high. Our solution is Novoc, an artificial intelligence that recognizes cancer on CT scans. It was built using Google's Inception program and trained on an additional 2 million scans, giving it a 98% accuracy on initial testing. This will be instrumental as it will save time by reducing the diagnostic time from 6 days down to 1 to 2 hours, save money as it will allow physicians to see more patients, and ultimately save lives by improving the accuracy to identify cancer earlier. This is our actual software being used. A physician will simply click and drag an image into the designated drop zone. From this, our AI will analyze the scan and provide several features for the user. It will provide a unique diagnostic ID that will comply with HIPAA and protect the patient's identification. It will also provide a confidence interval for whether cancer is present or not. In this case, this image of a lung CT scan generated a confidence interval of 99.3, which means that the AI is 99.3% confident that the image has cancer present. This information is also displayed graphically. Nationally, our market is a major factor in the U.S. economy with a projected valuation of over $200 billion by 2020. More in depth, our target market is larger health systems who deal with cancer diagnosis within 100 miles of Lincoln. More specifically, we are looking at private practices of radiologists, oncologists, and pulmonologists. Our main competition is IBM, Google, and Koios. However, these companies are located exclusively on the East and West Coast. None of these companies have any traction within the Midwest, making it an untapped market. For our business model, we are licensing out our product for $200,000 per year. With total startup costs of $120,000, our business will already be profitable with the first sale. Looking at the figure, you can see that our business will follow the hockey stick model, where we will initially have a high amount of startup costs, but within our first sale, that will be offset and we will continually be highly profitable with each subsequent sale. Projecting our business out, within 3 years, we will have 10 customers, which will generate $200 million in sales revenue. Our management team consists of 2 software engineers, 1 business professional, a head and neck surgeon, and the current COO of Methodist Hospital. What we now need is additional funding to make this venture possible. Our ask is for $30,000 for 10% equity. This will cover 25% of our initial startup costs. The other 75% we will be able to cover through private financing and grants. Help us in achieving our goal of helping hospitals save time, save money, and ultimately saving lives.